Hello, today we'll be talking a few things about normal newborn care. Firstly, we'll be talking about certain things which are seen in newborn period, which are normal and which are abnormal. And secondly, we'll be talking about the general care of newborn babies. So now coming to the normal issues, normal things which we see in newborn period, which are interpreted as abnormal. The most common thing among that is rashes which are seen over the body of the babies in the initial few days. They are most commonly interpreted as mosquito bites. It looks exactly like a mosquito bite, but they are called as erythema toxicum and they are migratory rashes. They keep on moving from one point to another and they are absolutely normal in the first few weeks of life. Second thing is a yellowish discoloration of eyes. The white part of the eyes looks yellow and which is very common in newborns, and most of the newborns will have some amount of jaundice. When it goes beyond a certain point, we go for phototherapy and treatments like that. And mostly before getting discharged itself at your treating hospital, the jaundice levels of the baby will be assessed and will be the actions will be taken accordingly. When it goes beyond a certain point, like when the palms and soles, everything looks yellow, even if it's checked earlier, you have to come back to the hospital facility and to do whatever necessary from the hospital. The next thing is whitish spots on the tip of the nose, which is commonly called as milia, which is again a common phenomenon in newborns. Whitish spot on the palate, they are called as Epstein pearls. They are also normal in newborn period. The other things which are common complaints of parents are hiccups, sneezing, stretching, straining, gurgling sound of babies, especially while taking feeds and early morning, late night time. And all those things are normal in newborn period. Towards the end of first week, the time when the meconium changes to yellowish motion, there tends to be something called as transition stools, which is loose stools which happens up to 10 to 12 times a day. It may go on for a week and that is absolutely normal. And beyond second or third weeks, baby may not pass stools at all for 2-3 days, which is also normal. As long as the baby is absolutely fine, you don't have to bother. If the feeding is fine, you just keep on feeding the baby and they are bound to pass motion after that. Mild bleeding from the umbilicus when it gets detached for 1 or 2 days is a very normal phenomenon. You don't have to do anything about it. Mild regurgitation of feeds, they are called as possetting. A little curd-like milk coming back is absolutely normal. That's basically because the gastroesophageal valve are not well developed and that tends to occur. A little bit of head end elevation will help the cause. Inverse sleep cycle, or otherwise the daytime the baby will keep on sleeping and the night the baby will be active and keeping on feeding. And when you try to put the baby to sleep at night, they keep on crying and that will cause a problem. So the only way to solve the issue is whenever the baby gives a chance during daytime, you have to sleep and keep yourself ready to take a night duty. In girl babies, there is something which is happening due to hormonal input from the mothers. What happens is when the baby is inside the uterus, some of the maternity hormones enter the baby and baby may transiently develop a uterine enlargement and things like that. And when the baby is out, once the this hormone supply is cut, the baby develops a little bloody discharge, like something like a pseudo menstruation. This is absolutely normal in babies. It may happen for a few weeks and it will just stop by itself. Breast engorgement in both boys and girls is again due to the same phenomenon of maternal hormone passage that also will disappear by itself. You don't have to do anything for that. And then BCG blood usually develops from 3 to 4 weeks of life. That is on the left arm above the deltoid muscle. You may see a small blood developing post BCG vaccination, which is again an absolutely normal phenomenon. Now coming to the abnormal phenomenon in newborn babies. Any temperature variation, be it hypothermia or hypothermia, to quote a value we would say less than 36 and more than 37.5, both are abnormal. And in newborn babies, more than fever, it's hypothermia which usually manifests in case of an infection. And as I mentioned earlier, jaundice going beyond abdomen, yellowish staining of palms and sole, all those things are abnormal. The whitish spots on the nose I told were normal, but pustules appearing all over the body with especially a red base is absolutely abnormal. Excessive crying baby, excessive lethargic baby are abnormal. And sometimes parents tend to feel that the baby is absolutely normal, sleeping quite peacefully, not even crying for feeds. That is not a normal behavior in newborns. They have to wake up every 2 to 3 hours to feed themselves. any convulsions, any poor feeding, they are abnormal. Coughing babies are supposed to have infection unless otherwise proved. Any fast breathing, normal newborn breathing rate is up to 40 to 60 per minute. So anything beyond 60 is abnormal. Chest retractions, the flesh in between the bones of the chest wall, if it is going inside with each breath, it is abnormal. Urine output expected in babies is around 6 to 8 times in every 24 hours. If that is not happening, that means that there is a problem in feeding and you have to take it into consideration and you may have to take medical help. Eye discharge, watering of eyes is up to a certain extent normal, but if you see a yellowish discharge, especially sticky discharge towards the corners of the eyes, they are abnormal. Umbilical bleeding a little bit is normal, but any whitish discharge from the umbilicus is abnormal. So now we have just talked about the normal and abnormal features in newborns. Now coming to the general care in newborns, the first and foremost thing is newborns find it very difficult to maintain their body temperature. So the babies should be covered very well. Avoid keeping them under direct air currents, directly under the fan or directly under the AC vent. And the room temperature should be preferably maintained between 26 to 28 degrees centigrade. And if at all possible, always use cotton clothes for the babies, especially the clothes which is coming into direct contact with the baby's skin. Minimize the use of synthetic diapers and wipes, and if at all you are using diapers, apply zinc oxide cream so that the rashes are minimized. And then cleaning the anal area, avoid wiping vigorously, try to clean in running water and mop with a cotton cloth. Once the cord falls off, you can start giving bath, but make sure that for smaller babies, the baby is achieved or attained a weight of 2.5 kg before starting bathing. You can use oil, and the best possible oil available is coconut oil. You can use coconut oil to massage the baby well, and then you can use mild cleansers to clean the baby. Now the recommendation is using Sindens, that is neutral pH soap-like baths for bathing the baby, and fragrance-free shampoos are also fine. Make sure that the shampoo are not causing irritation to the eyes when they are used. And now the next misconception is, there is a misconception of water entering the umbilicus, and most of the time you keep the umbilicus totally beyond touch, and then what happens is there tends to develop an umbilical infection. So while giving bath, make sure that you clean the umbilicus properly, and some umbilical bulging which is happening is umbilical hernia, and it has got nothing to do with the water entering the umbilicus. Cleaning the eyes is also important for first few weeks. What you have to do is soak cotton a little bit and wipe from inwards outside, so that whatever pus is happening is cleaned and it doesn't cause cross infection, and use separate swabs for both the eyes. Avoid powder application as much as possible, and if at all you are applying for a function or something like that, don't use puff. There is a possibility of the powder getting inhaled and causing problems. So smear them on your hands and gently apply on the body. And while putting the baby to sleep, always put the baby back to sleep and not in prone position. Once the baby turns over by himself or herself, that is absolutely normal, but otherwise the baby should be put back to sleep. And when the baby is small, that is less than 2.5 kg, provide KMC, which is a short form of kangaroo mother care, and give express breast milk as well for the babies. That is, on top of direct breastfeeding, you should express milk and feed the baby until the baby is totally full. Okay, thank you.